down one.
Yeah,
Please
I
sit down.
doubt Corey's going to sit here.
Hi, I was wondering if you were going to be here. How are you? I was going to call you and say, what should I say, T? Good.
Into house,
Hope not. Yeah. Go back to Radnor. How are they? Didn't you tell them that you're like, you can do that yourself? Right. Which side did you have surgery on? This side. You look fabulous. I know you do.
Yes, how are you? Okay.
Now look how fabulous she looks.
She did. Wow.
Yeah. Right. Yeah.
Yeah.
Right. Yeah.
Yeah, you know where to find me.
Your team right here. Do you know Kim? Like
Yeah,
she-
we did
right.
some,
Well, she's gonna. We'll just work your way down.
I see. We could have our CCB party here. Let's get Charlie here, Brian here.
I'm glad to see you out and about looking great. Is that right? A vegan. Yeah, you do look very thin. Is that, you think that that's healthy?
Total?
Is that,
no eggs? Awesome. I'm almost vegan. Yeah.
really?
I like it also.
What was,
I have to take some extra vitamins, but other than that, bean, sublingual.
okay.
She wrote the Idiot's Guide to Plant-Based Nutrition. It's great.
I love it.
I missed that.
I only
You
came
gotta
because
read
of
the
you, Michael.
details. Sounds wonderful. I can't just keep going. They don't let me out. Talk to Joe. He might let me.
Hey, Corey. So if we truly stay up for about 45 minutes.
What is it?
You know Laney, right?
What?
You know Laney, right?
No, no.
Yes.
You know Laney from Brian Swan's
We have 45 minutes,
I
right?
know
Yeah,
Bryce.
roughly.
That's his wife.
That's his wife. And
I'm going to introduce you, and then I think you'll introduce
The rest of the team?
yeah.
Okay.
Oh, so was he just there in August with Army?
I want to get everybody's attention. I know
he set it up. He does the whole bottom all
Maybe I can do one of
sets
these.
it down
Tim, you know.
if I can get everybody's attention, I'm glad everybody's had a leisurely and informative lunch. It's the last part of our program is about an hour, so we'll probably end a little bit late, perhaps around 2:15 or so. But the first part of this, I think, is going to be very exciting and very interesting, focusing on integrative medicine and wellness efforts. So beyond the active treatment for the cancer, what about the whole person? And in this regard, I want to introduce Jun Mao. He will moderate a case conference addressing integrative approaches that can be used in dealing with the cancer diagnosis. Jim?
Thank you, Corey. So in the next 45 minutes, what we're going to do is we're going to have a very multidisciplinary panel of experts here to help provide some information to really not just about treating cancer, but treating you as an individual. And so as many of you who have the experience of living with cancer or living with a history of cancer, you know cancer does not just affect one part of the body. It really affects each individual on a physical, psychological, and spiritual level. So it's quite important to bring in appropriate therapy safely and appropriate experts to manage this whole person and to really look at your health and well-being both on the present level and as well as in the future level. So I'll briefly introduce our panel, and then I will give a specific case. So we're going to discuss around this case, this individual, to see how we can formulate an integrative survivorship plan for this individual. So I'm Jun Mao. I'm a primary care physician as well as also an acupuncturist. And sitting right next to me is Kimberly Fleischer. She is the president of Reiki School as well as the lead volunteer for our Reiki volunteer program at the Abramson Cancer Center. Dr. Joseph Carver is an oncological cardiologist as well as the chief of staff of Abramson Cancer Center. Andrea Brenes, she's our lead physical therapist at Abramson Cancer Center. Last but not least, Dr. Michael Bain, who is the director of a mind-body program in the Abramson Cancer Center. So without further ado, we are going to, I will be briefly introduce this case, and then each of the experts will provide his or her opinion in helping this individual to cope the experience of living with cancer. And then at the end, we hope to have some time for questions. So for the sake of this, I'm just going to use a female as a patient, but it could really, this case can be applicable to both men and women. So this is a 68-year-old female lung cancer patient with history of non-small cell lung cancer. She has just completed a concurrent chemotherapy and radiotherapy. Her chemo regimen included cisplatin, etoposide. She also just finished several weeks of radiotherapy to the left thorax area, included about 6,800 grays of radiation. Before the cancer diagnosis, she has she's otherwise fairly healthy with hypertension and high cholesterol managed by her primary care doctor. She used to smoke 20 packs a year, but she quit 15 years ago. And since then, she has been trying to adopt a healthy lifestyle, eats mostly a plant-based diet. Prior to the cancer diagnosis and treatment, she exercised quite a bit, but because of the treatment, this profound sense of fatigue, she stopped her exercise regimen. After chemotherapy, she has this persistent low grade of nausea and has no appetite. The nausea never is bad enough to make her vomit, but she just really feel awful. And on top of that, she had this profound fatigue. In the way she described it was when she woke up in the morning, she feels fine, but just any little physical exertion, she'll be feeling completely wear out. And she takes frequent naps, but even the naps don't feel as refreshing as it could be. On a psychological level, she denied feeling depressed. She felt like she's anxious, but more important than anxiety is more the sense of uncertainty. Although her oncologist during the last visit a week ago told her her cancer is controlled, they're not going to do any therapy until 3 months later to repeat a scan, but she still feel like this cancer diagnosis just looming in the background. She has a lot of uncertainty and could not sleep. Fortunately, she has a strong faith, and she also has a really good family and social support. So I would say, as a primary care doctor, as well as an acupuncturist, when this individual walked in my office, what I would offer is often sometime during the cancer treatment, all we really have the energy and time to focus on cancer. So this right now, there's a period of time. There's no active treatment. It really offers opportunity to do a general check-in with the primary care doctor to make sure the blood pressure is still well managed, the cholesterol is managed. And I would say for her symptoms, acupuncture potentially can be very helpful on a number of issues. One issue is this nausea and vomiting. In large clinical randomized controlled clinical trials, there have been emerging data acupuncture to be really beneficial for nausea, especially for this. This case actually is drawn from a patient I've seen. Is she already have tried Zofran, Imand, as well as Ativan. Since none of the medication really made any difference, and some of them did give her side effects, make her even feel more tired. So this is really an opportunity to really try, give acupuncture a try. And for the patient I treated in a number of sessions, it really improved. And for some of the patients who are post-treatment, this sense of fatigue, I also use acupuncture incorporate with physical activities and exercise to help individuals to have a more sense of return vigor. And Andrea Brenes, our physical therapist, can talk about the role of physical activities in this regard. So I'll pass the microphone to Kim Fleischer. So we'll go down this way.
Good afternoon, everyone. So I don't know how familiar everyone is with Reiki, but it's a practice that doesn't treat specific symptoms specifically. It treats the whole person, and it's applied through really gentle, light touch. There's no physical manipulation, no needles, no pressing, no massaging, just gentle touch. And it really creates a space or an opportunity for the mind and body to move back towards its own balance and wellness and engage inner resources. So sort of as a side effect of that overall balancing, many people report a decrease of annoying symptoms. And one of the most common things that people will say with Reiki treatments, especially learning to practice on themselves. So Reiki has a component where you can use it as a therapy. You can go to a practitioner and they can apply the light touch. Or you can use it as a practice similar to meditation, where you can do it on a daily basis for yourself and pretty much lay your hands on yourself. And many people who learn Reiki as a treatment for themselves as a daily practice say that it improves sleep. That's probably the top 3 things I hear from new students. Also, a lot of people report that Reiki, either as a therapy or as a daily practice, helps with fatigue and a lot of the side effects of treatment, like nausea. And again, that space and the engagement of inner resources that happens through the time and the opportunity provided by the touch helps a lot of people with anxiety and just moving more towards an inner space of strength, of wellness, of good feelings, and away from anxious thoughts and things like that. So yeah, it could help with a good number of all of those symptoms, and maybe as we talk a little bit more, I'll add a few other things.
Actually, we'll skip Dr. Carver. We'll go to Andrea, and then Dr. Bain. Then Dr. Carver will wrap it up. Okay.
Okay. So again, I'm Andrea Branis. I'm a lead physical therapist in the Abramson Cancer Center. And as physical therapists, we have the opportunity to really address fatigue and strength and this patient's difficulty with exertion. And we're able to do that a lot with patients who've had a cancer diagnosis. A lot of the research on fatigue shows us that it's multifactorial, meaning there's lots of different reasons why people become fatigued. It can be from the diagnosis, from the lack of sleep, and the anxiety, from the fatigue after being in bed, or the loss of muscle, the loss of endurance, or the treatments itself, among many reasons. And so what we know is that even though there's a lot of reasons why people have fatigue, we know that one of the best ways to combat that fatigue is with activity. So we work very hard to get people up and moving. Sometimes it feels like resting will make you feel better, but actually we find the opposite is true, that when we can get people up and get them more active, they actually have more energy. So because this patient has had some chemotherapy and radiation and a cancer diagnosis, we would want to see her within our therapy clinic so that we could monitor her closely to make sure that she was not having any issues with blood pressure, with difficulty breathing, with her activity. We would want to evaluate how well she does with that activity and then be able to give her a home program that's based on her own parameters. So if she can come into the clinic and walk 10 minutes and feel good, then that's something she can do at home. We don't want her to go walk 30 minutes if walking 10 minutes makes her tired, because 30 minutes will not necessarily make her get better. It will actually just over-exhaust her. So what we do is we do a physical therapy evaluation, and we monitor very closely how her vital signs are doing and how she reacts to doing activity, and then put her on a home program to look at strengthening and endurance and flexibility. We want to give her whole body a chance to recover and help give her strength back. Then she will get into a program of exercising daily. We're not talking about going to the gym and lifting weights. We're talking about some gentle exercises in the home that will help her recover some strength. The other advantage to her doing those exercises is they will help with sleep. Exercise can help decrease anxiety and can help with return to lung capacity. The other thing we want to think about, just because of the treatment that she's gone through, is making sure that she is taking full deep breaths and that her posture is good. And so after a treatment like this, we find sometimes people have taken that good posture and turned it into kind of this forward rounded posture. I'm sure you all know about that. And that actually takes away lung capacity. We want to see enough strength in the trunk to get full lung capacity when this woman breathes in. That's going to help her feel better, it's going to give her more energy, and it's going to help her live her day better. So we want to use all of those factors to help her return to her normal self.
Right.
Okay?
Thank you.
So I'm the director of the Penn Program for Mindfulness, which is an applied mindfulness meditation program. And so what I'd like to talk about in this case is actually the connection between the body and the mind here. So this is a person, like all of us at other times, who has had some real shocks to their system. They've had a cancer diagnosis which turns your life upside down. Then they've had surgery, chemotherapy, and radiation, all of which are incredibly demanding of all sorts of physical and emotional resources. So it's not so surprising that she doesn't feel great right now. This is a really hard time. And I want to say two things about that. First of all, any system, if it's stressed or pushed hard enough, is going to have trouble. And I'm a little concerned that this person has been pushed hard enough so that actually the psychological part of her being has begun to fail in a way, insofar as she's not able to take care of herself properly. I don't mean that she's not dressing and eating and so on, but she's not able to have restorative sleep. She doesn't wake up feeling rested in the morning. Even when she has a moment when there's nothing to do, she's preoccupied with her uncertainty and her concerns about the future. So I think that aside from all of the medical care that she's receiving that's going to do the best that could possibly be done to cure her cancer and to take the best physical care of her, that it's her job now to take a little better care of herself. The first thing that I'm worried about is that maybe she's depressed. There's no stigma, at least in my mind, to that. If you push your body and push your spirit enough, and if you exhaust enough systems, your mood doesn't feel as good. That's something that we can help with. If you begin to have trouble with feeling anxious, which also goes with being depressed, feeling a lot of uncertainty or a lot of worries, not sleeping so well and feeling tired all of the time, that's something that you really need to talk with a doctor about. And then the other thing that I want to suggest to her is that she think about the other ways that she could really take better care of herself. I teach people to meditate as a way of giving themselves a time and a space where they don't have to do anything but to feel themselves, to feel their heart, to feel what really matters to them, and to do that in a way that feels like care, like a kind of love, really, for themselves. Who takes care of you? Well, the person in the best position to do that is yourself. And if you can make a little bit of time, I know everybody's too busy, whether you have cancer or have had cancer or love someone who has cancer, or whether you're one of the doctors in this room, you all need to take better care of yourself, to make some time, and to stop trying to do something else for just a little bit. If you would like to learn meditation, if you would like to do physical therapy, if you would like to do Reiki, or acupuncture, these are all ways of intentionally caring for you. And that's your job. Actually, whether you have cancer or not, but in particular, at a time like this, you better pay attention to that part of what's necessary as well.
Thank you, Michael. Dr. Carver?
Yeah, so I'm not the director of anything. So I would most likely get involved in this person's care because the physical manifestations of not eating and being nauseous and fatigue might cause one of the people taking care of her to say, maybe this is an effective treatment, or maybe there's some intrinsic problem that's physical that is leading her to not really be as good as she should be. So I would typically be asked, is the fatigue due to heart failure, or is her blood pressure low now and her heart rate a little fast? Is that because there's a problem with her heart? So I view my job as a cardio-oncologist as the true sense of integrative medicine and bringing together multiple disciplines. And in addition, because I'm an old person and been around for a long time, that I recognize everything that Michael has said, and that how much the mind plays on physical reactions, and how everything that you sort of frame, the way that you do it makes a giant difference and can be really therapeutic. So I don't just view my role as sorting out whether this is heart failure, or that the sac around the heart is inflamed because of radiation, or that there's an intrinsic abnormality of the heart muscle, or that the radiation has caused inflammation in the coronary arteries, all of which are possibilities, or that there's active inflammation in the area where she got radiation, and there's some sort of inflammatory or reactive pneumonitis related to her radiation treatment. But to quickly go through all the possible things that I just mentioned, from the standpoint of symptoms and physical examination and all the objective evidence that's there up to that point, and try to make an assessment about how much of this is just related to her overall treatment status and has nothing to do with intrinsic disease of either her heart and lungs. And when that's the case, I really do turn from a cardio-oncologist to a psychiatrist, and I try to be positive. And I know that in every interaction when you have cancer, the question that is always there that may not be verbalized is do I feel this lousy because my cancer is coming back, or that my cancer hasn't gotten better in spite of what people have told me? So that I try to reinforce the fact that this is a normal consequence of treatment, and that it takes time for the body to react to all the shocks that Dr. Boehm has told you about, and that try to come up with some easy things beyond what Andrea and Kim have talked about, from the standpoint of increasing nutrition and trying to get calories in and trying to get some fluid, to drink enough fluid, and to just reinforce that they are going to get better. And I think that that's sort of the role that I play. I'll tell you, I always tell the story that one day I was in a patient's room with a whole bunch of house staff and medical students, and somebody listened to the heart and said, and this was a person who was staring up the ceiling, obviously really depressed, little bit short of breath, and pretty sick. And if you had walked in, you would have thought, oh my God, this person's really horribly sick. And I said to the resident, what do you hear when you listen with your stethoscope? And they said, I hear a really vigorous heart murmur. And with that, the person perked up, the color returned to their face, and it was like a miracle occurred, because the word that person heard was that they were vigorous. And it's true. I think that what we say and how our facial expressions and how we frame everything that we say has an unbelievable positive or really negative effect on how patients do. And I only recognize that because I'm an old person.
So basically, I think one of the important thing I think this kind of meeting really we hope to achieve is, there are a lot of physicians, healthcare providers are not necessarily your oncologists, but they can play an incredible critical role in your health and well-being during your journey with cancer. And also, I want to highlight over at that table, the cancer support community. They also offer a lot of very important supportive care, yoga, or those other kind of things are quite important. So it's really, I think once you have heard the diagnosis of cancer, certainly, this alarm has, rang. It's really important as you start sorting out the treatments to begin figuring out. One way I'm very focused on, doing what my oncologists tell me to do to deal with the tumor, deal with the cancer. But on the other hand, it's really critical to really support yourself. Actually, a lot of the researchers are focusing on this issue is the host, like you yourself. It's really the battle between the cancer and you and yourself. So I think a lot of the things you're hearing today is really about how do you help yourself improve psychologically, physically, as well as spiritually. And so that way you have the best resource that you have to fight the cancer. So I would really just open the mic to the audience and to see are there any specific questions that we can help to address.
I don't really have a question as such, but I want to make a statement about something you just said. I found being a cancer patient, a very, how should I put it, another plateau in my life. I have lots of friends. There are some very close friends of mine that I chose not to say anything to them about it. They have no idea about my condition. They only know that every Wednesday they can't reach me because that's the day I get my chemo treatment. I was in chemo about a week ago, and one of the patients there said to me, "How do you feel?" I says, "Well, how can I put this? I feel okay, but I don't feel normal." And she said, "That's exactly how I feel. I never thought of it that way." And I think that's the way life appears to me now, that I'm not normal. I'm different, and things don't look the same. Everyday activities don't look the same. I stay away from folks who know I have this sickness, because when I'm around them, they exhibit the kind of attitude that they know I have it. They treat me differently. But those who don't know I have it I have the best time with them because they think I'm normal. I don't know if anybody else can relate to that. But I think that's how most of us feel when you talk about the psychological and emotional problems. That's where you are with this disease.
Thank you for that very profound and accurate reflection of the state of mind for a lot of the individuals. And I do think it's a really, I'm sure as those of us who work with cancer patients, is really, your words really capitalize a lot of the individuals, how you actually feel. I mean, having cancer on one way or another really have changed your life. And often I do think it's quite important to, I would say if we are redefining normal, it's a new different level of normal. I do think it really with time, I think actually we're doing a study on this. I think many of you may actually have already filled out the survey. We're actually finally beginning to analyzing it. We actually find a lot of the cancer patients, after they have been diagnosed with cancer, as time goes on, they're actually gradually able to find really positive meaning and benefit out of the experience of living with cancer. And that, in our research, about 300 of them have lung cancer, and about 600 of them have other type of cancer. Really, that it's a process, so it really happened with time. So certainly, that process can be very different for different people, but I would say, if it's normal, it's not the same normal. I would say pre-cancer, but doesn't mean it's actually for some individual actually that normal actually is even better than that pre-normal experience, pre-cancer experience.
I have a question actually pertaining to you. How does somebody cope with the fact that the people who know the diagnosis behave, you feel uncomfortable with? What kind of coping? I mean, I sense that that's part of the problem, and that sort of limits your vistas in some sense. Is there any prescription or mechanism for that?
There were two things that I wanted to. There were two things that I wanted to talk about, and I wanted to respond one to that. What I realized, I was diagnosed, and I've been dealing with cancer since 2007. And what I've realized recently is that no matter how much the people that love me and are close to me and my friends want to understand and be supportive, they can't because they don't understand. They're not experiencing what I'm experiencing. And I used to go through a thing, it's like, why would you say something like that? But then after a while I realized, well, they just don't understand. And in some ways, I wish I hadn't have exposed, like you, my situation as much as I did, because, like you say, it makes people change, and it's uncomfortable. So now I'm starting to back away from indulging in conversation with people who have not experienced cancer. In the beginning, it was being close to my family, which is wonderful, of course. But I believe that after a while, it becomes a burden not only to them, but to us, because of the misunderstandings and the uncomfortability. It's like they feel like they have, it's their obligation to, oh, how you doing? How you feel, Mom? Or you all right? You are all the time. It's like, really, if I cough, or if it's a little difficult for me to get up, you all right? You all right? And I don't want to, you don't want to, but that's uncomfortable. You don't want to burden people like that. It's like, I need you and want you to be there for me, but I don't want to make you uncomfortable, and I don't want to be a burden to you. So that's how I've experienced. I think it's the same thing that you're talking about, if I'm not mistaken. So that's how I deal with it now. This is something that I've learned recently. I would say within the last year. It's like I don't even bring it up. And also in the beginning, they had a lot of support groups and everything. And I in the beginning, I wanted to go, but I wasn't able because I was a little weak. I wasn't as strong as I am now. And I think I haven't experienced it, but I can only guess. Well, just experiencing this today, it's the first time I've ever been to the lung cancer conference. I really enjoyed it. I learned a lot. I met a lot of people, and I feel good. So that's probably where I need to go and to indulge more. I am a part of the American Cancer Society. I do some work with them. So, birds of a feather need to flock together. I mean, and the second thing that I wanted to say is that I go to a wellness center and I do acupuncture. I've done sacral cranial, if I can get that right, and I've done Reiki. Now, I don't want to overdo, and I'm sure that, and so I'm trying to figure out what is the best thing for me to do. And it may be something else. It may be one of those things or none of those things. How do I determine which remedy or how many remedies I need to focus on at any given time?
We're all reaching for microphones. It's such a great question. So I'll go first because I won't really give an answer, and then they can give you the right answer. What I want to suggest is that your body is smarter than any expert. So if you just take a little bit of time and listen, and not maybe have an idea. It's not about what you read in a magazine. It's like, what's right for you? I think that you usually end up in the right place. And then if that wasn't right, if you pay attention to that, you'll know right away. So really, being attuned to what's actually happening might be the most helpful thing.
That's what I was going to say. Something to sort of jump off of what Dr. Baim said. I think that we're always in a state of moving towards or hoping to move towards balance, and what that looks like in any moment or in any situation is different for every person, and even for the same person in a different moment. So I don't think there's a prescription. Talk to this person, don't talk to this person, tell these people, don't tell these people, or even if you do make a choice, tell them, don't tell them, that's going to be set in stone. I regret it, I don't regret it, depending on where you are. And practices like Reiki or meditation that give you a space and an opportunity to stop, to go within, to look deeply at what's actually happening, and then to assess, okay, do I need to talk to more people? I know what my heart's saying. Or do I need to back off from talking to people? Or, wow, I haven't been talking to people for a while, and that was really nourishing, and now I feel like isolated, and maybe I would like to reach out, but maybe I'll do it in a way where if someone bothers me or says something really stupid, I can find a mindful way to call them out on it, or whatever it is. In any moment, having a practice that supports the ability to do that, to have that space for yourself, to return to your own balance so that you can kind of create that balance with your community is so valuable. And also understanding what balance means to us, that sometimes we need to take care of ourselves and look to therapies like Reiki or acupuncture or something where someone is taking care of us, that we can take an hour or 45 minutes to just be totally nourished and nurtured by someone else. In some moments that might be helpful, and in other moments practices like meditation or a daily Reiki self-practice where we know how to have these and cultivate these tools to take care of ourselves are really helpful. And then when it's time to give back to others, so we can really do that in using combinations, and those combinations might change.
I will get to you. I just want to quickly, what we just witnessed is a really important care. One cancer survivor helping another. I would say nobody will ever know the disease as much as you do, and you are each other's teachers and helper in terms of going through this experience. And I would say also part of it about integrative medicine is there's no one prescription for everybody. And really about, and also the approach you each have may be different and may work for you, may not work for the other one. The only way to really find out is to talk to each other and learn from each other and figure out what works for you. And in terms of it with I would say, just speaking from acupuncture's perspective, I always say you need to try it long enough to see it works. In my experiences, typically you should give a therapy like a Reiki or acupuncture or meditation, at least a couple of treatments a try to really see, can you get into it, can you derive any benefit? But at the same time, like at least with acupuncture for a lot of symptoms, if you derive a certain degree of benefit, it doesn't mean you have to keep going indefinitely. It may be a little bit different for therapies like meditation or yoga. Probably requires some degree of what I call adherence or compliance to really keep up that sort of state. But really, I would say, don't feel overwhelmed. Suddenly you feel like there's so many things I can do. At least in the Chinese medicine philosophy, it's really the balance is the key. It's not really the more the better. It's really about like choosing what works for you and choosing in a sequential or combinational fashion that gives you strength, give you comfort, but don't overwhelm you, because a lot of time you have also the doctor's appointments, you have your personal life to take care of. The last thing you want to do is running from place and place, trying to do a lot, and that can be very overwhelming.
Not a cancer patient, but I was a patient advocate, and I was very moved by the two patients that spoke, and I just had two thoughts to say to them. Number one, it's a new normal. It's not the old normal anymore, and nobody knows what it's like to walk in your shoes unless they're doing it.
I listen to all the people, and I sometimes feel that I guess it's the new normal for me. I'm 11 years. This month, actually, 11 years since I was diagnosed and treated. And I can truly say that except for the initial diagnosis, I've just been very fortunate all the way through. It came on me unexpectedly. I thought I had a little bronchitis, which I probably did, and all of a sudden I started coughing up blood. I went to the emergency room, and just like you, well, 1 minute, and the next day you're diagnosed with possible cancer, and then 2 weeks later you're diagnosed positive. But unfortunately for me, I had non-small cell, and it was easily remedied. I had surgery, had right upper lobe lobectomy, and just as a precaution, they were suggested by some and not suggested by others, maybe I should get the chemo. But I took the chemo because of, always the fear that maybe you'll catch whatever else might be out there. But even with all that, all the time since then, I've never really I'd never dwelt too much on the cancer. And I've always, fortunately, been able to, live through it and live with it. And I didn't have a lot of people around me being sympathetic. And maybe it's just my makeup. I didn't dwell on it. I even went back to work after a while, and they were concerned about me going back to work. But that's the only way I knew how to go on, was to continue on. I felt that as long as I was living, it was my responsibility to do living things and not to dwell on the other aspect of it. And except for now here, and very rarely do I even talk about it with anyone. Not that I'm ashamed of it or whatever, but I don't feel, I just don't feel incapacitated by it in any way. And sometimes I don't want other people, like you say, making me think that, oh, well, you had cancer. Well, I could have had anything. There's so many things out there to have, and there's so many other ways this could have went. And I'm just so fortunate that it went as well as it did, and that I'm living as long, and living, I guess, the new normal, but very normal for me, the life that I have. And I still go yearly for the treatment, for follow-up, and every now and then something comes up and gives me a little scare. But fortunately, it doesn't stay long. And I just maybe encourage somebody to, if you don't dwell on it, if you can't, but if, everyone is not the same. And that's the way I deal with it. I don't think of myself as, a cancer patient in the long term. Every now and then something comes up and it reminds me and says, oh, you have cancer, you had cancer. But for the most part, I feel cancer-free. But I still realize I come to these things just to see. Every now and then I'm reminded that this can come back. And there are things that you need to keep abreast of and you need to be involved in. So I do that. But I've just been fortunate enough not to have to live and been healthy with it, and even through it, I was never sick. I went in for that. I had the surgery, came home, had the chemo, came home, and I was never really physically down with it. So I guess that's just another way, everyone, I had my cancer.
Well, thank you so much for sharing that experience. I think in the literature describing cancer survivorship broadly, really having the cancer, although it can be the most traumatic experience in your life, but it also can be an incredibly important, what they call teachable moment. There's never a time in life it becomes so clear that what are the priorities are and what kind of actions need to be taken to really formulate a plan and to really live a healthy lifestyle, to put things in order. And so you can approach life as aggressively as you can. I think in my experience working both in the cancer, with the cancer survivor population as well as with the general medical population as a primary care doctor, I often really enjoy working with cancer survivors. I feel like their life is so real and they're so motivated to try to do everything they do to keep living well, versus a lot of my other patients, although they are really have a lot in their hands, but they don't take their medication, they don't eat right, they don't exercise at all. So I do think, this could be a very good teachable moment, and really focusing on health and wellness, not really dwell on the cancer is critical to making that steps forward.
So I just want to say one thing. A friend of mine, Rabbi David Wolpe, who is a survivor of a brain tumor and non-Hodgkin's lymphoma, said that we're all survivors, only some of us know it. And I think that it's a very profound statement, and that once you do recognize that that's the fact, I think that your life is different and that you appreciate things a little bit differently. And the key that you all can do is to spread the word of how different life is and how and facetiously how lucky you are to be able to survive and approach life in a different way, and to try to teach other people before they get cancer to try to do that.
Oh, that's exactly what I was going to say. Thanks, Dr. Carver. That I'm so grateful to Penn, to doctors, and also to survivors for sharing with each other and all the support services we have, that everyone I know has cancer. I mean, knows that I have cancer. Sorry. Everyone, I just tell everyone. I told a lady last night that I picked up at the train station because she was elderly, and I just shared it with her, and she said, oh my goodness, that's wonderful. And that helps me. I'm surviving 4.5 years. And it's just something that we have. And I think that the more we concentrate on helping others, that the better we feel. And also the doctors, Doctor was over there and he smiled when the mindfulness expert, Dr. Blaine, was talking about our doctors sometimes need, and he smiled, Corey Langer. I thought, well, we should really remind them again that, without them, we wouldn't be here.
Hi. I just wanted to say I don't have cancer, and I've never had cancer, but my sister did, and she passed away in 2006, and my mom did. And she passed away in 2007, and this is my aunt, my maternal aunt, and I just wanted to say to her and the woman that we don't know what to say. And I know for me, when my sister was alive, I was afraid to talk to her because I didn't want to make her feel uncomfortable. And now, my aunt knows I'm kind of like her stalker. I back off because I know that people are calling, and it's probably annoying that everyone wants to know how you're doing and how you're feeling, and, oh, are you okay? And nobody wants to hear all that. I wouldn't. But at the same time, I still want to do the things that I used to do, which is stalk her every day. So I think, well, last week I stopped over and we did yoga together, and I was all excited. I was so tired. I was ready to fall asleep. And she says, "You're tired." I'm like, "No, I'm not tired." I was tired, but I just wanted to spend that time with her and do something normal that we would normally do if she wasn't sick. But I didn't want to pressure her, and I don't want to call her and bother her on her bad days because I've seen my sister go through the chemo and the vomiting and on and on and on. So you need to tell the people who, whatever, get on your nerves because they want to act like you're weak and, handicapped, that, this is a good day, I want to be bothered. This is not a bad day, get off my phone. Because we need to know. And like I said, we did everything together. So we need to know that when you want to, if you want to, and if you want us to leave you alone, just, tell us to leave you alone. So that's all I wanted to say.
Great. I have to say I've learned so much from this session from all of you, and thank you for sharing all those experiences. Really, I think integrated medicine wellness is about you, and you are taking control of that experience. And I think, like many of you have really alluded, it's really about defining a new normal and really, moving through the experience of having cancer and into long-term wellness and well-being. Thank you very much.
We are at our last session of the day. And again, I want to thank everybody from this wonderful panel. I don't know about you, but I found this session very empowering. The only extracurricular activity I do is I belong to a literary group and a poetry club, and I've actually written a poem about all of you called the bell jar phenomena. And I think those of you who have gotten this diagnosis, you do feel like you're in a bell jar. That people are looking at you and scrutinizing you from every angle, that it's a tough situation. And I think some of the advice from the panel and also from fellow survivors is quite pointed, that sometimes you need to set the parameters, because those of us who have not had cancer really don't know how to react. We haven't gone through the experience, so you need to define for us. And for those of you who find it difficult, that the disclosure changes your relationships, then in some situations it may be important to get counseling to help cope with that. I think that's quite crucial. Our last session, Susie Stonehouse, is I've had the privilege of knowing Susie how long now? 10 years? It must be close to that. When she was a NP student, she is no longer a student. She's my right and left arm. My right and left leg is her co-partner, Vicki Sherry, and they really help me take care of all of my patients. And she's going to chair our survivorship panel and also focus on some of dealing with toxicity. So, Susie?
I'd like to have our survivor panel just come on up and sit up here, and I'll introduce you. While they're coming on up, my name is Susie Stonehouse Lee, or Susie Lee. And I just feel privileged to be a part of the team that cares for these people and for many, many other patients that we see every day. What's that? Yes. The first patient, first person coming up is a patient. Mary, I'm going to have you go first. Yeah. Mary Lou Vitale, who's a patient of Dr. Langer and myself, and just welcome her up, or you can sit there. That's fine. Would you rather? Yeah. Okay. And have had the privilege to know her, and I'm excited to hear what she has to say. Thank you.
Hi. I thought what I would do is just, sort of run through an overview of what my history has been with lung cancer, and then spend a few minutes talking about the things that I think have helped me get through and the things that I still find as challenges. And hopefully some of this will help or resonate with the rest of you. I was diagnosed in April of 2005. Like a lot of you have mentioned today, it was found incidentally. They were looking for something else when they came across it. I was originally a stage 3A. I had surgery to have the upper lobe removed, followed by chemotherapy, and then 7 weeks of radiation. So that was a long year. Since that time, I've had 2 recurrences, which have necessitated removing what was left of my right lung, and has necessitated 2 more rounds of chemotherapy. I am currently in maintenance therapy with Avastin. I go once a month, and there's no visible sign of the cancer. So hopefully the last round of chemo got it out of me. We shall see. So that's sort of like, it's been a long journey, but it's still going on, and I think through all of this I've learned you can handle just about anything. Some of the things that I think have helped me, the people who work with me know this, I feel very strongly about the role of exercise, the sort of just keep moving. No matter how bad it feels, just get up and move. Sometimes that meant I kept going to the gym. Sometimes that meant after they took my lung out, I walked down the hall a couple of times in my house. But in any case, my theory was that if I kept moving, it would just get better. And today, because of the lung removal, I need oxygen to exercise, but I've found ways to do it. I think you can always find ways to do it. I go and I use the treadmills at Penn where they have oxygen available, and I take Pilates and I bring my little oxygen tank with me. I found a Pilates instructor that was willing to deal with that. So I think it's really important, and I encourage any of you to, not jump in and do exercise you never did before, but try to at least keep up what you were doing before and build on it. Another thing, and this has been, I think, talked about a little bit later this afternoon, that was really important to me was I went and found a support group. And I was like the least likely support group person you could ever want to meet. I'm very independent, I can take care of it myself kind of person. But I realized pretty early on that I was having feelings and emotions that I wasn't sharing with the people around me because I didn't want to upset them. I had a very dire diagnosis, and I didn't want to say to the people who love me, I'm thinking about the fact that I'm going to die. So fortunately, I realized that I needed to have a safe place where I could go and say those things. And I found a support group. Now, when I was diagnosed in 2005, most of the support groups that were specific to a type of cancer were breast cancer. But what I found at the wellness community was a generic for people with cancer, which turned out to be perfect because it was all about those initial feelings of what it means to to have that diagnosis. It was all about what it's like to go through chemotherapy and the different treatment modalities. It was a safe place to say what I was thinking and feeling, because regardless of the type of cancer, a lot of those thoughts are the same. Eventually, I also started participating in a more specific lung cancer group, which was a good place to stay educated, up to date on progress and things that were going on specific to lung cancer. But I think going to that support group where I could get things out and not worry about how people in the room were reacting was a really, really, at least for me, important part of going through this. The other thing that I got out of that support group that wasn't what I had anticipated was I had people who understood what I was talking about that could help me sort of plot out or plan how to make decisions. How to, if I had something I was uncomfortable talking to the medical people about or asking, they could help me figure out a way to do that, how to approach a subject that I was uncomfortable with, or if I had to make a decision, how to approach that decision, because they'd all had similar experiences or were going through similar experiences. So I would encourage people, because a lot of the emotions that people have been expressing this afternoon are the same ones that I think most of us have or go through, and that's a good place to figure out how to manage them. Another thing that for me was a tough one was accepting help from people. You know, everybody wanted to help, and I wanted to do it myself. And it took me a little bit to finally figure out that by letting people help me, not only I really did need it, but also I was helping them. Because all those people around you that are asking all the time how you are, and they're in your face and you don't know what to say, they need you to give them something to do so they feel like they're helping you. So I would say when people offer to help, let them do it. It's not just good for you, it's good for them too. And they feel more like they have a role in helping you towards your getting better. And then the last thing I had was, and Dr. Langer mentioned this morning and it's been discussed a little bit more, is giving back. I mean, we've had an experience that not everybody understands and has been through. So for new people that are just being diagnosed or they're just going through type of treatment for the first time, you can help them with that, and it's a fairly easy thing to do. You know, I talk to people on the phone who have just been diagnosed or have just had recurrency diagnosed and are going to do a type of treatment for the first time. The medical community can tell you all about radiation therapy and what it's going to do for you and what it's not going to do for you. They can't tell that person what it feels like to be laying on that table the first time, and all the people that work there run out of the room because they don't want to be exposed to what you're about to be zapped with. And that big machine is going to start moving around up over you. I mean, you can say, yes, it's scary as shit, but you'll get through it, and this is how I did it. I mean, that's something, no matter how hard the medical community tries, they can't do. You can do that. You know, I've talked to people, I do phone buddy stuff for one organization. I've been involved in a lot of small group stuff. This for me today is a little moving out because this is a big group. It sort of feels very public. But I mean, I think we can all help that way because we know something the medical community doesn't know, and that's what it's like to really be the one going through it. Challenges. Now, we all have ongoing challenges, and a lot of them are the obvious ones, but the ones that sort of stand out to me, the long-term impact of all the treatments I've been through. I mean, my body just isn't the same anymore. And part of the sad reality is, while it was being changed by all these treatments, I was also getting older. So you have the combination of, you know, I've had all these cancer treatments and I got old. It's a different body, and you sort of have to learn to figure out what you can do with it. And I think, you know, your energy level's different. Sometimes I have days when literally I can't seem to get out of the chair. And then I have a debate with myself. All right, well, that's to be expected given what you've been through. Or, no, you're just being lazy, get up out of the chair. You know, it's hard. You've got to figure out what your new body will let you do and whether or not you're challenging your new body. Because sometimes I think it's easy to just say, oh, well, what do you expect? And not get up out of that chair. I mean, so I found that to be a challenge. All sorts of long-term, ongoing impact of treatments that all the medical community can tell you about. But I mean, it's real and it's there, and if something hurts and something doesn't feel the same as it had, go and tell them. You can never tell. It might be important, it might not. But you got to go and tell them, even if they get tired of hearing from you. I think another thing that I personally have found challenging, after my second surgery and they took my lung out, I was never really able to go back to like the professional life I had had. You know, it's just, I just don't have that energy level. And so I've had to build a new life that accommodates who I am now. And that's been hard, and I've struggled to do it. I've made progress, but you know, it's not easy. You can't be the person you used to be. And I keep wanting to be that person. But you know, you need to let yourself accommodate that new person. And you know, then there's the stigma thing everybody talks about. And I'm less concerned with the "did you smoke" stigma. I'm sort of over that. I'm sorry that, you know, it gets in the way of raising money. That's a serious concern. But if people, all right, I smoked, I admit it. But what bothers me more, I find harder to deal with, is what a friend actually just helped me put a name on, is the mortality stigma. The fact that there's an expectation that if you have lung cancer, you're gonna die. You know, so somebody is gonna think of that when you're applying for a job. Somebody's gonna think about that when they're entering into any kind of relationship with you. You know, and how do you handle that? And I think in my case, at least, the reverse can be true too. I can say to myself, oh, why bother take that on, because I'm not, probably a short-termer anyway. You know, so that's a whole nother challenge that I think at least I face. And then, of course, there's the big one. I never sort of gets very far from my mind that I'm just waiting for the other shoe to fall. You know, once you've had one recurrence, I think then that's something that I at least haven't figured out how to get away from that yet. So I do a lot of mind control. But it's an ongoing challenge. I hope that helps.
Yeah, thank you so much, Mary. I really appreciate your candor and your, sharing your experience with us. The next two, I'm going to introduce them together. Bill Pinchuk and his wife Elaine. Bill is one of our patients as well, and Elaine is going to be speaking as a caregiver. So I don't know which one of you wants to go first, but
Bill,
I'll go first.
okay.
So, I'm Bill Pinchuk, and I'll go back to the beginning a little because I resonated with, particularly on the last wellness panel, with what Mike and Joe had to say. My first indication that I had a problem was some weight loss, and I think I lost about 5 pounds. I'd been thinking about losing weight, but not that quickly. So I called my doctor, and he said, well, let's do some stress tests and get an X-ray, and that led to a CT and then the diagnosis. And I think from that point for me, I think I've always had maybe not a huge ego, but certainly an ego. And I'll describe it as a you, or this for you this way. So if we start up here, after the diagnosis, which was stage 4 lung cancer, it was like a descent into hell because I had started to lose more weight, and after about 25 or 30 pounds, I lost 55 pounds altogether. You know, when you look in the mirror and you know you're robust, and then all of a sudden, you know, you see the skin hanging, and you wonder, you know, where this descent will take you. It's a test for anyone. But I think that after starting treatment, finding U of P and Dr. Langer, and that was a trip in itself because we had started at another hospital, and there were a lot of red flags coming up. So we decided to look further. And I don't know how many of you have had gone for second opinions. Certainly, that's part of that trip. And I think the important is the decision. Well, first is your attitude and how you view life. And I'm the kind of person who doesn't look back. Now, why poor me? Why did it have to happen to me? That really never entered my mind. I always look, I guess for me, the glass is always half full, so instead of half empty. So I always looked at the positive side and never did that trip down. But in the meantime, when you're descending into that hell that you don't really know about, and you're nauseous and throwing up and coughing and doing all of that stuff with the lung cancer, it is a test. And one of the things that I decided to do was to tell people about my condition. I'm a professor at Rutgers University, and so there was a decision point to tell them. And what was amazing to me is the outpouring of care and synchronicity to my condition. And people all of a sudden said, "Oh my God, you know, I've had cancer," and this, and there was like an acceptance and a support that was incredible. I also found out through this experience that there are a lot of people who you talk with about cancer who do not know how to respond. They just they don't have a clue, and I suspect many of you have seen that. And so, you know, for those who respond, that's fine, and for those who don't respond, that's okay too. And I mean, respond in a way where they don't know what to say or do, and so it's kind of a cutoff or a shutdown. And I think so sharing was very important, and for me, the most important thing was I wasn't much into meditation or counseling, so I didn't pursue that, and for me, I was okay with that decision. Probably the most important thing of all is having a supporter and a caregiver, and so my wife, Elaine, has been all of that every step of the way. We were talking earlier about keeping notes of everything that happens and all of the data and details of what's going on, the medications, the care for me in terms of even ordering medications and following through on appointments with doctors. And I think that's such an important part, that somebody is there with you. We just had a call from a relative of ours, and he said don't tell anyone, but my wife has breast cancer. And I said, "Oh, you know, that's terrible. How is she being treated?" And he said, "Well," he says, "you know, she goes with a girlfriend to the doctor for chemo," and I said, "Don't you go?" And he said, "No, no, I don't go." "And do you know what she's getting and what she's?" And "No, we don't. I don't know anything." So the supporter, the person who's closest to you, who can help you through the mental and physical stress is, in my estimation, the most important. She had mentioned a support group, and I can't say we have many friends and we have family, and in part that has been the support, but I have never joined a, quote, support group, unquote. And that's just me. But I have such great support here that it kind of makes up for it.
Thank you.
Oh, boy. And he does say thank you all the time for the support, and he lets me know how important I am in his life, and vice versa. I have to say that one of the things that has made it easier is the fact that we both have that positive attitude. We are, they interviewed me a little while ago, and that's going to be on some video that you'll all be able to see. But I always feel that we're living with cancer. We're not dying with cancer. And I think that if you think about that, we have been given a gift of a year and 5 months right now, and we have appreciated every day together. And I think that is so valuable. We just lost a friend who went to the doctor at 9 o'clock in the morning, and at 12 o'clock that person died. And that wife never got a chance to even speak to her husband or say she loved him or anything. So she's left with that trauma forever. We have been building memories, and we have been going places and doing things as best we can. When there are fatigue times, he's always apologetic. I'm tired and I'm sorry, I have to take a nap. I am thrilled that he's taking the nap. I tell him, go with the fatigue, get your nap, and when you wake up, you're going to feel better, and we'll do something. And that is how we go forward. It's never a problem. Whatever he's facing, we face it together. I have been to every appointment. I think that is so important to have some consistency. I know a lot of people can't do that, and they have a friend going one time and another time, but I think knowing what's going on, I have a record of every appointment with what he weighed, what his blood pressure has been. I mean, we've had some positives. He used to be on blood pressure medication. Now he's not. His blood pressure is controlled because of whatever is going on now in his body. And that has helped a great deal. Keeping very active. Now, for both of us, I think that, you know, if you start doing what he said, that poor me and why did it happen to me, and staying in your home a lot and being isolated, I think that's just terrible for a future and for building a life. What we do is he has been continuing to do as much work as he can. He's cut back, but he certainly is still very involved in multiple things. And I have done that too. Even though I retired immediately after the diagnosis, I've kept involved with several different organizations that I'm involved with. And I think that you need to have something that's yours, because you don't know what the future holds. And you do need to have something that anchors you as the caregiver. It can't just be about taking care of the other person. That's not really helpful. And the thing about giving back is very important, what you talked about. Lately, several people have called us to get information about how we are coping. And it's because they've heard about how well we're doing. And it's because we continue to do things, like we're going to the theater on Sunday, and we're going to buy tickets for another show. So it's not a year down the line, but we're going to go a month or two down the line. So we're doing something futuristic, but not outrageously, so that, you know, we're not aware that things can change at a moment's notice. That's pretty much what I have to tell you.
Well, she didn't mention that in October of 2010, while I was at the bottom of this trough, before Corey got me on the medication that started pulling me up, she heard from her daughter that, and she's 50 years old, she was diagnosed with stage 4 non-Hodgkin's lymphoma. So here she thought she might lose me and then her daughter. So she was dealing with two of these events, and that was a tough time on her, and she held it back pretty well because she felt that, well, I was her primary, but her daughter was just starting, had just been diagnosed and was starting chemo. So you have to be strong as a supporter and encourage, and especially encouraging.
Thank you very much. It's been a privilege to see the two of you supporting each other through this, and it really comes out in how you treat each other and just being strong for each other. So I really have appreciated knowing that about you. And our fourth and final panelist is Melody Beverly. And she's a patient of Dr. Evans and Beth Sandy, and so I'm excited to hear from her. And then after that, we will open it up for some questions and comments. So go ahead.
As she said, my name is Melody Beverly. I'm a mother of 4 adult children and have 2 young grandchildren. I have thousands and thousands of nieces and nephews, half of which are in the audience here today. I also have grandnieces and nephews and great-grandnieces and nephews. We have a very big family, and they hold me on a pedestal. I was diagnosed with stage 4 non-small cell metastatic lung cancer in August of 2007. I went into the emergency room after coming home. I had recently gotten a second job. I came home with a headache. I went to sleep. When I woke up, I couldn't move the left arm and my left leg. Didn't go to the hospital. I waited until Monday and drove to work. And fortunately, when I got there, they wouldn't let me in the building. They put me in the car and took me to the emergency room. When I got there, lots of tests, lots of testing. And I actually overheard the triage nurse say that I would have to have emergency surgery. I didn't know what type of surgery. Ultimately, I found out that it was brain surgery that I was going to need. The whole time, I think I must have went into, I guess, a kind of a shock, because I just kind of went through the motions, but I was listening very carefully, and I was fortunate that the doctors were every time I turned around, I was talking to doctors, and I really felt quite important. Everybody just kept coming to me and they kept giving me this information, and I was glad because I was able, I was the one to make the decision. They gave me, that type of respect. I have heard people had experiences with doctors that they think that they're God, but that wasn't my experience. They talked to me, and I had a lump. If they found that I had a lump on my brain, and I had a lump in the back of my brain. I had cancer in my lung, I had cancer in my adrenal gland, I had cancer in my kidney. So I had to make the decision as to whether they would do surgery or radiation on my brain. And I talked to a doctor who had to be as old as Moses, but he was so, in his wisdom and in the way that he carried himself and in the way that he spoke to me, he explained, it made me understand things that I know, because I am not scientific in any way. I'm a word person. But he made me understand, he made me feel confident and secure, and I decided to go with the surgery. So, I went with the surgery, and as my family waited in the waiting room, scared to death, not knowing what would happen, and expecting me to be in, I don't know what kind of state, imagining all kinds of things. I don't know what they were told. But I went into this surgery, and it was the most, I never felt a moment of discomfort. I don't know who, and I always said, I try to remember, but because of the brain surgery and brain radiation, actually, I don't remember well. I don't remember names and things like that. But I would like for my anesthesiologist to know that he or she, I don't know whether it was a male or a female, but I felt so comfortable through that whole process, from the anesthesiology to the recovery. I even remember the guy who pushes the bed back to the room. Everybody, it was just, it was an experience that I would have thought would have been frightening, but it wasn't. You know, I just felt very comfortable. And I mean, obviously that was with the grace of God first, but with those people who were taking care of me, I just felt wonderful. That is until they gave me the crazy test. And I don't know if you know what the crazy test is, but you may or may not have had one. If you've had a brain MRI, you have had a crazy test. Because when I went into this, when they put me in this thing, and I'm trying to do everything I can to cooperate because these people are trying to take care of me. So I'm going to go into, they put you into this tube, and it's very tight, and you're laying back. Then they put the cap right there on your face, and it's tight on your face. And then they put you in this tube. Oh, my God. Oh. And I prayed, and I tried my best, and they give you this little thing with the horn to push if you need to come out. And I prayed and prayed, and then when I went in, you go in this machine, and then the metal thing start going around, and it goes clang, boom, ha, ha, bring, blang, blang in your ear, and it just goes, and you're going, and it's going around and around and around. And I was like, oh, God, please, I gotta, this is best for me. And then finally I had an epiphany. It's like, well, you know what? Nobody but a crazy person will put themselves through this. I wouldn't care what it was. And I'm not crazy. And I was very happy, and I pushed that button. They said, well, you don't have very long to go. I said, I don't care. I'm not crazy. You have to take me out of here. So they took me out, and they gave me some medicine, and that made it easy. Well, not easy, but better. So I went, and I did that crazy test. And then after the brain surgery, I went home. Then I had to do brain radiation. Now they want to take me to the twilight zone, where you go into this, it's dark, and you see it's just, so I consider this my cancer experience, and fortunately, like I say, dealing with the doctors and having the support of my family, I made it through. And I realized that I was so blessed because I'm here. Whatever I was going through, and it wasn't easy because I had, as my niece said earlier, I lost my sister, my oldest sister, and one of her daughters, my niece. She died in my arms. But it was a good thing because I hugged her. And I held her, and I prayed in her ear, and I told her how much I loved her and how much we loved her and how much we were going to miss her. So, and we've gone through so much more, but it's all right because it is what it is, and it's going to be all right. And I'm not afraid of death. I'm not afraid of cancer. I'm bored of cancer. You hear me? Bored to death. I love life. I love my family. And I love you guys here. I haven't, it's the first time I've ever been to a cancer conference. I don't know why. But I'm so glad I'm here. I'm so glad I came. And I thank you for listening. Listen to me. Let me tell my story. Thank you.
Thank you so much, Melody, for sharing. Right now, I'd just like to open it up. You can use the mics that are out there if you have a question for one of our survivors, or some comments, any comments that you would like to make. Yeah.
Any takers? Comment?
These guys have said it all beautifully,
Right.
so.
I think your comments have been very empowering, and for people like me, actually very rewarding as well, because we don't get to do this periodically. Our interactions with our patients are very constricted, 5, 10, 15, 20 minutes. Just the facts. We don't really have time to look at all the other angles, all the other issues that come up as much as we'd like to, but then we need 48 hours a day, I think. And, it's important, obviously, for the practitioners to be as available as possible, within limits, but still quite available. Elaine, you had a comment?
Yeah, I just wanted to say that as a caregiver, you also need to have to go with your gut feel. And if you think something isn't going right, we had a situation where he was coughing and we went to a pulmonologist and we didn't really get any relief. And then I just kept listening to this and it just sounded worse and worse. And that wonderful ability to call after hours, that phone number that Penn gives you, I called 5 times in one night, and by the next morning they said, get him to the hospital, and we went through 4 days. It was exactly a year ago, and it was really going downhill, and we got out of that hospital, and that night I thought, we're losing him. It was that bad. And we left a message for Corey, and he called at 11 o'clock at night and get him in here the first thing in the morning. He got him hydrated, turned this whole thing around, and by that weekend, this was on like a Thursday, and by that weekend, he was able to go to his granddaughter's bat mitzvah. So it was a miracle, and it's exactly 1 year ago. So I feel that's something that a caregiver has to pay attention to. You're seeing that person day in and day out. And I asked the pulmonologist, I think he has an infection. I really think we need an antibiotic. No, we really need to get that cough out. We need to, and that's not saying the person, wasn't a fine doctor. I do feel that person is very, very knowledgeable to this day. But I knew that something wasn't right, and we needed to get that care. And so the 4 days that he was in the hospital, he was on 2 antibiotics, and there was just a tremendous amount of stuff that had to be done for him.
Hi, my name is Inez Tunstall, and I'm almost in tears. Well, I am in tears. I'm a 2-time cancer survivor. Breast cancer in 2000, lung in 2005. And I was one of those people that wasn't a smoker. And I'm not going to go into detail, but I'm just so happy to be here. And I don't know who to thank, because, people don't understand when you're going through something like this. I have 7 handsome brothers, 6 beautiful sisters, and about 45 or 50 nieces and nephews. They love me. They're around me. But just being here just brings tears to my eyes. And I'm doing well. I'm doing very well. I still have some breathing issues. With me, I didn't have surgery, just chemo and radiation. So I cough quite often. I cough every day. But I'm thankful for that. I'm just thankful to be alive. And I have so much more to say, but I'm tongue-tied. I just want to thank whomever everybody in this room for having this session. Thank you, Doctor.
Thank you, Inez.
Any other comments or thoughts?
Okay. Yeah. Thank you all for being willing to share your experiences. I think it really is invaluable to just hear your perspective and share these things with each other, because there is a deeper level that we don't get to in clinic and in the visits, and it's really important for us as human beings to just share that. So I really appreciate it, and again, I'm just very privileged to be a part of this team and to know you, and we thank you all for coming today and showing your support and for each other and for this program. And with that, I guess I'll wrap it up. I think Dr. Langer is going to come up and close us. Thanks.
So I want to thank all of you for coming today, those of stalwarts who have managed to stick it out to the end of the day. It's been, I think it's been a very informative 6-7 hours. There are forms, green evaluation forms in each of your packets. We really would welcome your comments, both good and bad. I already have ideas for next year. I realize there's a fairly high percentage, probably a much higher percentage of you who have been never smokers or minimal remote smokers, and we need to focus on that as well as other issues that have come up. So again, thank you all for coming. Thank again the panelists have shared their stories. It's hard to do that. Some of you are very practiced at it, but others are quite new to it. And you know, there's for me, as I said before, it's quite empowering. So again, thank you all. Have safe travel home.